Galantamine. It is another cholinesterase inhibitor used for Alzheimer's patients, but it's also used off-label for diabetic neuropathy, neuropathic pain, post-op pain, and hot flashes. Now it comes in a regular tab taken PO 2 times a day or an extended release. The maximum dose for extended release is 24 milligrams, and the regular release, the immediate release, needs to be increased dose every 4 weeks until you hit your max dose of 32 divided into 2 doses. This thing is metabolized in the liver and excreted in the urine, so you're going to want to make sure that you have baseline LFTs and a kidney panel. Don't really want to use it if your creatinine clearance is less than 9. Side effects are typically directly related to the mechanism of action. So you'd have abdominal pain, anorexia, bladder outflow, obstruction. Don't ever use it with that. Brady, dizziness, dyspepsia, nausea, vomiting, diarrhea, insomnia, a skin reaction, depression, headache, rhinitis, tremor, confusion, cough, and constipation. Now, interactions include anticholinergics. You wouldn't want to do that. Bethanechol, cimetidine, and all kinds of other ones that are filtered by the liver. You don't want to use it with succinylcholine or St. John's wort. Never use it in severe renal or hepatic impairment. Be careful if you've got asthma or peptic ulcer disease, COPD, bladder obstruction, or supraventricular problems, seizure, bradycardia. That rash you're watching out for, that would be Stevens-Johnson syndrome. So make sure you are looking for a rash with bumps. If you have to stop taking this for any reason, for more than 3 days, you're going to want to restart at the lower dose. You don't want to go into a cholinergic crisis. Remember, cholinergic crisis is very wet. You're going to be salivating and have lung secretions. Not good. Now remember that this thing has a dual mechanism of action. Not only does it inhibit cholinesterase, but it also sensitizes nicotinic receptors to receive acetylcholine. So that might be why it works in neuropathy and neuropathic pain and post-op pain and hot flashes. Remember where our cholinergic receptor subtypes are. We've got the N ones that are all in the ANS ganglia and adrenal medulla for like actual nicotine, and then we've got the NM at the contract skeletal muscle, and then we've got muscarinic, which does the eyes, heart, lungs, bladder, GI tract, sweat, sex, and vessels.